Welcome to Sports Ophthalmology, a podcast for ophthalmologists and trainees interested in providing eye care to athletes. Join as we hear from national leaders in this exciting subfield of ophthalmology.
Hi, everyone. My name is Trevor, one of the new co-hosts of the Sports Ophthalmology podcast. Today, I'm joined by Alex Suh. Alex is a recent graduate of Tulane University School of Medicine and a freshly matched ophthalmology resident at the University of Southern California's Roski Eye Institute program. Throughout undergrad and medical school at Tulane, Alex completed multiple internships and clerkships with NASA, where he contributed to groundbreaking research on spaceflight-associated neuro-ocular syndrome, or SANS, ensuring astronaut safety on future missions, whether it be to the moon or Mars. All right. Alex, welcome to the show. I know because you just graduated from medical school at Tulane and you're about to start residency, and you're trying your hardest to relax. So thanks so much for making the time with us. So we'll just get right into it. So what first started your interest in space medicine and ophthalmology?
Yeah, first off, thanks for having me. I really appreciate it. I know you've interviewed many giants of ophthalmology before me, and I'm surprised that you're interviewing a former medical student, just graduated yesterday. So I really appreciate you having me on. But yeah, I guess I'll start with my story of how I got introduced to space medicine before going into ophthalmology. I grew up in Iowa, and I remember just looking up at the sky growing up and seeing all the stars because there's not much light pollution in the area. And I've always been fascinated with space. I went to preschool at a science center, the Science Center of Iowa, and they would show clips of the shuttle missions being launched up. And I'm sure many others can relate, but I was really mesmerized. So I decided to go to medicine, and there's always this inkling of curiosity of like, okay, is it possible to work for NASA? So I applied for over 100 internships at NASA, just shooting the shot, seeing if it'd stick. And I actually landed one, but then the pandemic put it on hold. So then I entered medical school, and I decided to just reach out one more time and say, is it possible to fit an internship during medical school? And they invited me, and I got placed in the cardiovascular and vision lab at Johnson Space Center in Houston, Texas. So that was my first introduction to space medicine, which I didn't know existed before then. And we did a lot of cardiovascular and ophthalmology research. And I just fell in love with how space medicine and ophthalmology can come together, and really learning about the effects of microgravity on the eye. And soon enough, I progressed to medical school, applied for ophthalmology, and just excited to continue to dive in.
Yeah, like you just mentioned, space medicine, not a lot of people know about. Space medicine and research in the eye, much less so. And as you already know, we're on a sports ophthalmology podcast, not really a space ophthalmology podcast, but we could draw some parallels, space exploration in sports, extreme physical demands and lots of cutting edge technology. How do you see the parallels between these two, and how has it influenced, if it has at all, your path into medicine?
Yeah, so I was thinking about that, and I realized you're right. There's a lot of parallels between sports ophthalmology and space medicine. The first one that comes to mind is you're working with the healthiest of the healthy who are competing at such a high level. NASA crew members will be selected based off of their education path, as well as meeting very, very stringent health requirements. And it's very similar to athletes. Athletes need to be performing at the top of their ability. And as we know, vision is very important for, completing the tasks and competing at a high level. Interestingly, there is a crew member who's on Crew 10, who's on the International Space Station right now. Her name is Nicole Ayers, and she was a D1 volleyball player. So that kind of brings in a little parallelism of like how, a lot of astronauts are former athletes, and vision is very important in order for them to complete their tasks. And I guess one aspect about being in microgravity and being in such a remote and austere environment is being able to manage trauma. And trauma is very, very prevalent in in sports ophthalmology as well. So we can kind of find different ways of managing trauma here on Earth, terrestrially, specifically sports trauma with such a healthy population, kind of possibly translate that over to managing ocular trauma that could occur in a austere environment such as the space station.
Yeah, in my limited experience, couldn't agree more. And just diving into what specifically you did at NASA, in regards to your research as regarding spaceflight-associated neuro-ocular syndrome. For the listeners, could you just kind of break that down, what that is and why it's so important and a significant concern for astronauts?
Yeah, for sure. So I think listening to the podcast with Andy Lee that you guys had previously, because like I mentioned, you've interviewed some of the best of the best ophthalmologists in the world. But with my limited experience, being a medical student working in the cardiovascular vision lab, I had a lot of exposure with experiments and research with spaceflight-associated neuro-ocular syndrome, or SANS. And there's four main tenets of SANS. There's optic disc edema, globe flattening, hyperopic shift secondary to that globe flattening, and choroidal folds. And it occurs in 70% of crew members who engage in long duration spaceflight. And that's categorized as being in space or microgravity for greater than 6 months. And I guess the reason why NASA finds this particularly interesting and very important is because if a crew member loses their vision in this austere environment, then they wouldn't be able to perform mission tasks. So they want to continue to do research to ensure that the astronauts do not lose their vision. It's actually categorized as one of the red risks by NASA. And one of the red risks means that they need to do everything possible to mitigate or prevent this from occurring. Yeah. So a fraction of the 70% who have SANS will have vision impairment. And the only known solution to that is that vertical vector of gravity, meaning coming back to Earth. So it does resolve within a year for most astronauts. So we'll see. The missions are going to will be becoming more and more complicated, going to the surface of the moon as well as possibly Mars, and they're being longer and longer and in more austere environments. So we'll see where it goes. It's definitely something to be curious about, and hopefully no crew members lose their vision in the future.
Going on to the next question is, how do you see the skills you're developing as a budding ophthalmologist yourself applying to space medicine research, or vice versa, how your space medicine experiences will help you become an ophthalmologist?
So when you guys invited me to be on the podcast, I was very surprised. Once again, I'm just freshly graduated medical student, and I haven't had immense amounts of exposure to ophthalmology, but this is what I hope. I hope to really learn more about the ocular system as well as the anatomy of the eye, and translate that over to understanding how microgravity may affect what we know as the normal anatomy. I still have lots more to learn, but as we continue to do more research and as we continue to learn more about microgravity's effects on the eye, especially with these missions going to the moon. Next year, they're going to fly astronauts around the moon and back, which hasn't been done in let's see, nearly 60, 70 years. So I hope to learn more about anatomy, and they actually recruit subject matter experts at NASA, both optometrists as well as ophthalmologists, who give insight on these injuries that may occur, or also SANS. And I hope to bridge these two understandings of more complex missions as well as ophthalmology in the future. But I still have a lot more to learn. Definitely.
And you mentioned SANS, and as we kind of touched on before, it's not really a well-known topic of space medicine as well as ophthalmology in space medicine. Are there any other ophthalmology related research that's going on in NASA that you could tell us about?
Yeah, so there's this space analog called head down tilt bed rest. Because there's very few astronauts that go up to space, there's very, very limited data. So it's easier to perform large data sets on larger populations and more diverse populations here on Earth in order to better understand the effects of space on the eye. The only issue is you can't really perform space flight, or collect space flight data when you're here on Earth. So what they do is they do head down tilt bed rest. And essentially, they take subjects and they lay them at a 6-degree angle with their head below their feet for anywhere between 30 to 60 days. There have been months and months experiments in the past. And at NASA, they developed a strict protocol where they're only allowed to use a special side sleeping pillow, as well as they're not able to perch themselves up. They have to defecate and urinate in that position, as well as eat. It's a very grueling task, and most people would not volunteer to be in this study. But essentially, because they're laying at this position, all the fluid shifts are going to their head. And that's very similar to what happens in spaceflight, because you don't have the vertical vector of gravity pulling the fluids to your feet. All of it goes up to your head. So if you look at images of crew members on the space station, you'll see that their head's a lot more full. So by laying these subjects at this angle, that their head will become a lot more full, and they've actually been able to induce optic disc edema and choroidal folds in these subjects. So they can then develop more effective countermeasures to pull these fluids back down, or try different medications, or do some gene analysis to see who's more susceptible to SANS during spaceflight. And it's not the best analog, but it's the best thing that we have today. So very interesting studies, and they actually perform them at the DLR in Germany, and then they send the data back to NASA to analyze.
Wow, that is amazing. I'm actually speechless. Wow, I kind of knew that, everyone kind of knows that when you go to space, you kind of lengthen an inch or two, but not everyone knows that you grow a big head when you're in space either. So thanks for that. I guess moving on to, your time as a future ophthalmology resident, congrats on matching to USC. I'm sure you're really excited. What drew you to USC, and what do you most look forward to as a future resident?
Well, thank you. I guess I'll target this more for the target audience of yourself, like medical students or maybe possibly pre-meds. Ophthalmology is the best field for sure. And, a match is a match. I would have been very happy to go anywhere in the country. I interviewed at some great places, and I was drawn to every single one of them. But at the end of the day, I guess if I'm hyping up USC, why it was my number one choice is because first off, it was a little bit closer to family. My parents moved to Southern California about 3 years ago. So closer proximity to family was a huge draw. I'm a huge golfer. Back to the sports ophthalmology theme. I love golf. I've been playing every week since I've been, in fourth year med school. There's light at the end of the tunnel. And interestingly, USC is the only one that advertised a resident physician golf scramble. And it's actually going to happen in 13 days from now, from when we're recording. And I've been practicing as much as I can. And I'm very excited to I guess, bond with the faculty through golf. And then, of course, it was the residents. When you're interviewing, you get to do these socials, and you get breakout rooms with these residents. You get to ask them any questions. You really look them in the eyes, because the eyes tell a lot about how much they're enjoying their experience. And now you could really see that they work hard, but they also have time to have fun, golf, play pickleball, play all these sports on the side. And that was a huge factor. So with the great weather of California, the residents closer to family, as well as just really strong surgical experience, I couldn't be happier to where I'm going.
That's awesome, Alex. And, it's clear that you have a passion for space medicine. Do you still plan on, integrating that in your space medicine research during your time, with the demands of residency and all that?
So it was really difficult. I actually did a remote internship with NASA during my second year of med school during preclinicals. And that was very difficult because I was required to give them 15 to 20 hours per week on top of the demand of going to classes. But I think it'll be very doable. But of course, going into residency, I know that the number one thing is to become a good ophthalmologist first. Because if I'm not a good ophthalmologist, like we mentioned before, if I don't really know the anatomy and the pathology and physiology of the eye, then I wouldn't really be able to bring space medicine into it. So I'm going to go full force into becoming the best ophthalmologist I possibly can. And then I'll find some bits and pieces of space medicine and continue to contact my mentors to find projects on the side to continue my passion in space medicine and ophthalmology.
Yeah, definitely, as you should. And what about, potentially something, after residency? Is this something you want to think about potentially integrating within, your potential career?
So I did both aerospace medicine clerkships at Johnson Space Center as well as Kennedy Space Center. And I spoke to many, many flight surgeons, not only for the crew members, but also for, occupational health within the communities. And I think the number one advice that they gave me is become a good ophthalmologist first, and then integrate space medicine after. So I do see myself participating in one of the aerospace medicine residencies or fellowships in the future. Not all of them are accredited, and that's a discussion for another day. But I do know that space medicine physiology is very, very interesting to me, and I think some further education and more training would allow me to better understand ophthalmology and space medicine. But my ultimate dream is to be a subject matter expert for NASA one day. I want to be the phone call. I want to be asked, hey, can you analyze some of these OCT images for me? Or can you give us some advice on how to approach this ocular trauma? So I know it's a daunting task. I feel like if I keep telling myself that, then eventually it'll happen because I was told multiple times, focus on studying your medical school curriculum. Don't do these aerospace medicine clerkships. You'll be applying for aways soon. I did 2 away rotations in ophthalmology, and I was told to do 2 more. But I said, you know what? I really love aerospace medicine. I want to do clerkships in aerospace medicine. So I took the leap of faith and integrated it into my schedule. So I'll find a way. It's going to be difficult. I do know that, especially during residency. But after, I have big dreams.
Yeah, we believe in you. You made it this far, right? So just a couple more questions. What advice would you give to medical students, undergrads, or even residents who are interested in number one, just matching into ophthalmology or getting in the field of ophthalmology, but also just combining the 2 fields of ophthalmology and NASA or space medicine?
So I did a match panel here at my school, and they asked me the exact same question. What advice do you have? And I said, find what you're truly passionate about. Of course, the route to ophthalmology is competitive. I'm going to be honest, but if you find what you're truly passionate about and somehow find a way to integrate ophthalmology together and bridge that passion and go full force into it, then you'll set yourself up for success. So when I first started, I knew I was passionate about space and medicine. And I knew I was passionate about ophthalmology, so I found the bridge to bring it together. So that's the general advice for this pre-meds and medical students. Find what you're passionate about and go full force into it, and I think it'll sort itself out. In terms of, getting involved with aerospace medicine, especially ophthalmology, aerospace medicine is an integration of so many different specialties. They have subject matter experts for every single system. They have orthopedic surgeons who consult at NASA. They have, of course, ophthalmologists, ENT, PM&R, because a lot of crew members have joint problems and they need better ergonomics with their suits. So it's an integration of so many specialties. So no matter what specialty you want to pursue, there's a spot for you in space medicine. And the best way to do that when I was early in medical school is to join the Aerospace Medicine Association. There's other chapters at different medical schools. It's called the Aerospace Medicine Resident and Student and Medical Student Organization, AMSRO, Student and Resident Organization, AMSRO. If your school doesn't have that, I highly recommend starting a chapter. It'll definitely give you more connections within the Aerospace Medicine Association. Going to these conferences every year, I think, is the best way. They offer so many different scholarships. And if you just have an inkling or an abstract or some sort of project that you could bring to the conference, it will definitely open up a lot of doors. And the community is small. Ophthalmology community is very small. I feel like everyone knows someone, but it's even smaller within aerospace medicine. And the people who go to these conferences are the most interesting, intelligent, and passionate individuals I know. They come from a wide breadth of backgrounds. You have Marines, you have dive medicine experts. Yeah, they have ophthalmologists as well. So there's a wide variety of people going to these conferences, and it's a good networking opportunity as well as to see what's going on and what kind of technology is being developed. Because I really do believe that space is the next frontier, and as missions get more and more complicated with the commercial crew program, as well as all these different little private sectors coming in and wanting a piece of the pie, there's a huge future in space medicine.
All right. Well, that kind of closes it out. The last question I have for you is, you mentioned golf already, but what is your favorite sport? And do you have a favorite sports team?
My favorite sport is soccer. I grew up playing soccer in Iowa when I was 4, and continued to play intramurals throughout undergrad, as well as in medical school. Played on a city league as well. So soccer is my favorite sport, and I've been a huge Messi fan since I was a kid. So I'm going to jump on the bandwagon with Inter Miami. They still have a lot of work to do, but I love watching Inter Miami as well as Barcelona, because I grew up watching them as well.
Gotcha. Well, thanks so much for joining us today, Alex. For those of you interested in following Alex's journey as he combines his passion for space medicine and ophthalmology, be sure to check out his Instagram at alex.suh, where he shares his insights into his work, his NASA experiences, and his path in medicine. We wish you best of luck in your residency at USC and can't wait to see what you accomplish, Alex. Thank you so much for joining the show.
Thanks, Trevor.
Thank you for listening to Sports Ophthalmology. To stay connected and learn more, you can find us on Twitter, YouTube, and at our website, sportsophthalmology.com.